Hi, Dr Fran here. I am the Lowdown's resident doctor and also an NHS GP. I'm here today with my eye bags and my acne and my 7-month pregnant bump to talk to you about the COVID vaccination in pregnancy. Well, we know from lots of research that compared to being pregnant and not being pregnant, if you catch COVID, you're much more likely to end up with severe disease or even in hospital. I have horror stories from my anaesthetist friends and even my younger brother who had to look after heavily pregnant women in intensive care. Well, we have research from 100,000 women in America who've had the vaccination with no ill effects to either them or their babies. We know that if you get COVID, you're 2 to 3 times more likely to give birth early, which isn't good for your little one. And personally, I like the fact that I might be passing on COVID antibodies to my young one so that they're protected when they're born. We have 100,000 women in America who've now had the Pfizer or Moderna vaccine without a problem in pregnancy. So the NHS has decided to take that data and use those 2 vaccines going forward in pregnancy. Luckily, it now couldn't be easier to book in for yourself. You just go to the NHS booking service, let them know that you are pregnant, and it will direct you to a specific clinic for either the Pfizer or the Moderna vaccine. We don't actually know, we have no data saying that any time is better than another. So the choice is still very personal. I chose to wait until after the 12-week scan. I've got other doctor friends who chose to wait until after the 20-week scan. Then I have other friends who decided to crack on and get it done as soon as they knew they were pregnant. As I say, there's no data either way, we just want to make sure that you're protected. Well, as I said, I had the Oxford AstraZeneca and I've been fine. And the recommendation at the moment is that if you have no adverse or ill effect from the first dose, go ahead and have the second dose. So hopefully you'll go forward and try and get booked in to look after you and your baby. If you still feel like you need more information, there's always your GP or your midwife, but a really good place to start is just by Googling Pregnancy Vaccination Decision Aid. There's a brilliant document by the Royal College of Obstetricians and the Royal College of Midwives which summarises all the information and helps you make the right decision for you. I've been Dr Fran from the Lowdown. I hope this has helped and good luck with the pregnancy.